Welcome to Our City Matters. My name is Tashirik Chubadi. It's a pleasure bringing your company once again this evening as we take a look at the important matters in our city. Of course, it's Cape Town. It's a beautiful city, but if one just scratches beneath the surface, there are some problems that we need and challenges that we need to deal with. One of it is health and the state of our health here in the Western Cape and in Cape Town. Tonight in particular, we're taking a look at the state of our health, whether in some cases, pulling the plug on hospitals or, dealing with the chronic shortage of, chronic medication. Tonight we try and put all of this into perspective with Dr. Louis Reynolds. He is from the People's Health Movement. Also on this program is Andile Madondile. He is a training facilitator at the Treatment Action Campaign. Gentlemen, welcome to Our City Matters.
Thank you.
Perhaps, Doctor, if we could start off with you, just what is the People's Health Movement?
The People's Health Movement is a global movement organized around the fundamental right to health. Health is a fundamental human right. So we focus not only on health care, in other words, on health system, but also on the causes of ill health. The social determinants of health, and
so that would be finding out where TB originates. It's not just about treating TB; it's about
treating TB, but it's about how people get TB, who gets TB, why do they get it, why do they have lack of access to treatment in some cases. So that's what we focus on, and it's different in different countries. In South Africa, we're quite small, but we have sort of circles in mainly Latin America, the Indian subcontinent, other parts of Africa, even Europe and North America.
So how do we fare if you look at our health system, be it in South Africa, or if one want to trickle it down to the Western Cape, how would we fare, in terms of global standards?
Well, we're not doing very well in terms of global standards. We're a rich country, or let me put it this way, we're an upper middle income country. We're not a poor country. Yet we have health outcomes, in other words, life expectancy and child survival, that's in keeping with some countries that are much, much, much poorer than us. And there are many countries that are poorer than us and actually doing better than we are. And so our state of health in relation to our wealth is extremely poor. And the reason for this is that we haven't really dealt adequately with the social determinants of health, the social and economic and political determinants of health. And these are things like poverty, lack of education, inequality is a huge determinant of health. So, and these are not really problems that the health department can deal with on its own.
Yeah.
These require other sectors. Our four big disease groups are trauma and violence, disease related to around the time of birth and maternal health. Then we have infectious diseases like HIV and AIDS, TB as big burdens. And finally, we have a growing epidemic of non-communicable diseases. These used to be called lifestyle diseases, like high blood pressure, heart disease, cancer, obesity, diabetes. So these are four big burdens. Now, all of those have important causes that are located in communities and that need approaches that go beyond the health sector. The health sector can do its bit, but requires, for example, education, is a big determinant of child health. So these are the reasons why we're not doing as well as we should. Other countries that are, as I said, that are poorer than we are actually doing better.
Okay, so there's clearly something we can do about it. I mean, Andile, the TAC is known for, fighting for antiretrovirals, etc. That is where it shot to fame. But beyond that, clearly the TAC does more. When it comes to listening to what Dr. Louis Reynolds describes, the focus at least of healthcare in this country, surely it's a much bigger problem that we're not dealing with.
Yes, I concur with Doctor that there's still a lot that needs to be done in terms of health, especially dealing with HIV, TB, and other communicable diseases such as cancer. There's still a lot there. People, they lack of information. That's the first thing. and there's also poor funding of the NGOs, you know, where we can reach most of people outside there, you know. I think, yeah, that is a problem that we are facing currently, but we are trying as TAC to reach as much as we can, people, you know, clients specifically, as much as we can, you know, but although due to lack of funding also, it also has impact on our work.
Right. But I with this discussion, of course, while I recognize that there are much broader problems, and I think this is why the UN comes up with these fancy terms such as Millennium Development Goals, which in essence is perhaps good. But let's trickle this down to responsibility of our elected officials. I don't want to absolve Dr. Aaron Motsoaledi nor the MEC for Health here in the Western Cape. If one takes a look at the challenges, I mean, hospital staff, poor attitudes, we take a look at shortage of medication, the streamline of certain medication. It's unforgivable that those are still governing issues that we're still grappling with, Doctor, isn't it?
Yes, you're absolutely right. You know, I don't know where to start with this, because you can start in the storeroom where things are on the wrong shelf and so on. But you can go up to global trade agreements that influence what drugs cost in different places. And you can go into the kind of political, economic philosophy of that the country's sort of undertaken. And we have, in the last few years, adopted an approach that devalues public goods, for example, you know, like healthcare. So that, and it subjects it more and more to the market. So we have this incredible inequality in our health system. Not only social and
are you saying,
economic.
just to break that down, are you saying that if I need a particular cancer drug, or I need a particular drug of some kind because it's going to cost me 800 Rand instead of 200 Rand, because of that inequality, I won't get access to that if I can't afford it?
Well, there are some things that are like there's an essential drug list, okay, that should be available in all the public facilities. Is not, and that's due to poor administration, poor management, and so on. Then, sorry, I've lost my train of thought because of this thing. But sorry, what is your question again?
My question is, because clearly there's been a problem before with these patent laws, you know, with the inequality when it comes to access to basic health. And getting your hands on this life-saving medication. I mean, these are pharmaceuticals together with government. I know Dr. Aaron Motsoaledi, to give him credit, he has been fighting this particular matter, but surely, you know, it's not about the buck at the end of the day.
Well, I think THC has done a lot in this field of the patents and their impact on drug availability. But again, if you're rich, you can afford stuff because it's on the market. So, but if you're poor, there's some things that you will not be able to afford, and you might not be able to even find a facility that has essential medication. And this is unacceptable in a constitutional democracy based on human rights, where we all should be seen as having equal rights, equal opportunities, and it's just not happening. And I think that we've missed many opportunities since the transition to democracy. The apartheid health system was bad. We had 14 departments of health in those days. Now, thank God, we've only got 2, private and public. And again, those need to come together, in my view, to provide people with a right to do what they have rights to.
And Dile, I see you want to jump in. Patent law is a serious problem to, you know, dealing with a health issue in this country.
Yes, it is still a problem because sorry, there's still a lot, as the doctor indicated, that, you know, there's a lot of equality. We are very equal in terms of the book, in terms of the constitution, but in terms of practice, our government, they don't even play that role. And they also painting the health system as it is very good in the public or in the media, but when you go down there working on the ground and found that, hey, there's still a lot of work. I heard that you have spoken about the shortage of medicine in some areas. They still, and there are nurses that are got a bad attitude in the health system. And also, when you touch up the issue of patent laws, it also has a bad impact with that. So let's hope that the NHI thing is going to start, but even that NHI the national health insurance that the government is talking about, it doesn't suit us, everyone, as they were promising us, as a people, poor, marginalized people. If I can tell you, if I can tell you,
okay,
poor,
if you can talk to me about the NHI, I want to leave it for later. Save it for me, because
Okay.
I want to, as part of going forward, whether NHI is a solution to our health problems in this
Okay.
country. But I want to take a look at government focus here and the responsibility, because I want to single out a case that affects Cape Town and the Western Cape in particular. We of course had the closure of the GF Jooste Hospital. Now that hospital mainly sought to the Manenberg, Heideveld and surrounding areas. Subsequently, no deadlines have been given. We're not sure what is happening with that hospital. Mitchell's Plain is now forced to deal with an over-reliance on its particular services. Maybe if we can start off with you, Doctor. What do you make of this closure of a hospital with no indication about a replacement anytime soon?
Well, the closure of GF Jooste, which was a very busy, in fact, I read somewhere it was the busiest hospital in the Western Cape before it was decommissioned. But it was unable really to deal with the burden. Remember I spoke about the burden of disease, much of which is preventable. It was unable to deal with this burden adequately. And the idea, as far as I understand it, was that they were planning to rebuild it, a better hospital in the same, on the same premises. And the hospital was decommissioned, and the emergency services and the overnight facilities where people need acute, if they're very sick, they need those facilities, was shifted to Heideveld and I think also to Mitchell's Plain. Now, this has caused a huge problem for the people in those areas, because they definitely have poorer access. And the burden on those other two hospitals has obviously increased enormously. And I think part of the staff attitudes that we're having is related to work stress and just dealing day in and day out with very, very sick people. This is very stressful. I know, I've been there. So I think it has been an incredibly disruptive thing to dismantle the hospital.
At least one with no plan.
With no plan. There doesn't seem to have been, well, there was a plan, I think, to rebuild it, but that seems to have been changed. And I believe that the site is going to be used as a police training center. But as far as I know, no new site has been identified. And the plan, there's no involvement or very little community involvement in deciding where to go with this problem.
Yeah. Doctor, before you go to your next thought, we're going to have to go for a break, but I want to, in the meantime, while we go for this break, think about the fact that somebody that might have driven 2 minutes to the hospital now has to contend with a 5 or even a 20-minute drive to Mitchell's Plain. That could be a moment really between life-saving and, of course, ultimate death. So think about that as we return. We're talking about the state of our health here in the Western Cape and in South Africa. When we do return, we can pick up this particular conversation. Do stay with us.
What makes a good villain? Or should I say, what makes a villain any good? Is it a certain je ne sais quoi? Oh my. A sense of style? Wow. A way of doing things or getting things done? Is it in your commanding tone? How about your super cool gadgets? Or your super cool hideaway? The femme fatale is pretty much mandatory.
Hi there.
Just like your trusty sidekick, always there to make sure you don't miss a thing. Hi. So go on, let's hear it for the bad guy, just this once. Because let's face it, the good would be rather sad without a little bit of bad.
We're talking about the state of health in the Western Cape in South Africa. Is there an issue with this service, this delivery that we expect from the government, and also inequality within the system? And for us to have this conversation, we're joined by Dr. Louis Reynolds. He is from the People's Health Movement. Also Andile Madondile, he is a facilitator at the Treatment Action Campaign. Andile, I want to jump in with you here now. This GF Jooste matter, I mean, understand, yes, we need a bigger hospital, we need greater services, and if you're telling me we're chucking a down building and you want a better, bigger one, then sure, tell me when, tell me how, give me time frames. At the moment, that doesn't exist.
Yeah, it doesn't exist. As the doctor has indicated, there is no plan, if you can say so. Although the city of Cape Town, they claim that there is a plan to build, because before what they did to the community, to the people, they say that okay, now they're gonna build a half while the other side is working on the meantime, but only to find out now
the police station.
they're building a communication. I think there was a lack of communication or communication with the communities. Just imagine, I'm a very poor person staying from Inyanga or Tepe, and then I have to travel now a long distance in order to reach a healthcare service. Hence I say that, but in our constitution it is clear, section 27 states clear that I have a right to better healthcare service. But now I have to waste a lot of money. What if I'm not working? Is going to have a problem, and then we are going to see a lot of people defaulting from their treatment as well, So for me, I think government needs to come up with a plan, a clear plan and a time frame as well, and sit down with the community. You don't just take a decision alone without consulting the people. Yes, they will claim that they have consulted the people, but I can tell you only few people that they were consulted, because that hospital were catering so many areas around even Kailicha before we have a KTH.
Kailicha, yeah.
We used to work from Kailicha, take a train, go there for Tutuzela services, special,
and to sit for 8 to 9 hours in the queue.
Yes, and then they said, now okay, we've got because of the shortage of bed, but what do you do? What is your plan in the next coming 5 years that you add more beds in that hospital? So it's just a scapegoat. Our government doesn't want to take a responsibility. They are they are very serious in terms of making money, in terms of making something that is profitable for themselves.
Yeah. Doctor, a very important point that Andile ends off on there, because often the City of Cape Town, the Western Cape government tells us, well, financially we're looking good, we're performing well as a municipality, we have good services, etc. But Nyanga, Kailicha, Hanover Park, what, Manenberg, they don't have a hospital. They don't have beds.
Well, yeah, again, when people give you these figures, they're often talking about averages, but averages hide inequalities. So you can have one very good place and a whole lot of very bad places, but the average will look all right. I think it's very important to realize that Cape Town reflects or reproduces the inequality in South Africa as a whole. We can see it, even if you look at child survival, it's much worse in Kailicha than it is in, say, Rondebosch, so children who are born there, just by the fact that they're born there, that's where they are, end up with a much lower chance of survival than if they were born somewhere else. And these are unacceptable things. Now, you're talking about the health services. I think the fact that USD is no longer there is a fact. It's a fact. Yeah. The health problems are still there. And it's essential to involve the community. I think Andile has made a very important contribution here. It's essential to involve structures in the community organizations, not only NGOs, but community organizations, in planning what to do next. Because just to sort of build a new hospital somewhere is, is it the priority? Is it not? There needs to be some kind of process here that involves the community and that also involves other sectors. Look, you're talking about people needing urgent care who may be in Manenberg. The crime situation in Manenberg is enormous. Lots of the people who need care are there because of crime. And these are the upstream causes of the burden on the health system. I think it's not right to focus narrowly on the health system's responsibilities. A much broader government, state duty is to provide services, to protect citizens, and so on. And that's, where things are lacking too.
I think we're still very far away getting the government to think more broadly and holistically when they deal with some of these social problems. So let's get into our solutions. National health insurance, it's been touted by the Minister of Health, it's his baby. There's a piece of legislation in Parliament at the moment to pave the way for NHI. What are your feelings? Do you think it could begin to try and deal with the types of problems that we're sitting with?
Yes, according to the books, yeah, it can, but in terms of practice, I don't think so.
Why?
I don't think so, because yes, it is a good thing, and we also endorse it as TAC and other and other organizations, because of it was made very clean and easy, the way that you can understand national health insurance, but now it taking time in order to be implemented in our areas, as you know that the piloted area, it is in Eden district there. But now, if I can ask you, when are they going? They don't have time frame. When are they going to implement in the metropole? If I can speak in the metropole, meaning in Kaili, Chanyanga, all those areas. But there is no clear plan at this point in time. Otherwise, it is a good thing. It's going to eliminate a lot of, I would say. Otherwise, it's going to combine, the two private sector and the public sector to become one. But there is a problem there because, number one, there is a shortage of doctors in South Africa. There is a shortage of nurses. There is a shortage of healthcare workers. There's a shortage of medicine. Pharmacists. If I can talk, there's a lot of things. But let's hope. We are still hoping that maybe. But as long as we still have problems, some clinics or hospitals are very dirty. We have a KDH in Kailicha, if I can speak, but that KDH doesn't serve the purpose of people of Kailicha, because there, if you can go there and do research on your own, you'll find there's shortage of beds. People are sleeping down there. There's a lot of, and people, they don't even trust it. Same thing as Tigerberg. Hospital, there's a lot of cases that are coming to our offices that we need to deal with. Some women, they just give birth, especially in the maternity unit. Some they didn't eat, they have to be transferred in Tigerberg to get operation. But we've got a multi-millions hospital in Kailicha. But let's hope this national health insurance is going to work. But for us now, we don't even have a hope because no one is talking about it. It's only few people now that are talking about the national health insurance. I don't know. The government will just come at the last, say, okay, now we are implementing it in Kailicha or in the metropole. But without consulting the people, that's where the problem is going to.
All right. Consultation, you say.
Consultation is the key.
Dr. Louis, Andile mentioned a few things: shortage of doctors, shortage of nurses, resources, so on. These are always things that are of concern. So is this a matter of, cutting off your nose to spite your face type approach?
Look, I think the National Health Insurance scheme, the idea is a fantastic idea because it creates a big pool of money that is used to buy health services for the nation on a basis so that if you need healthcare, you can get it free. You don't have to take any money. You don't have to, it's free at the point of delivery and it's paid for in advance, mainly by tax. But the process for the National Health Insurance has become stuck, it seems. They've brought out a green paper in 2011. That's more than 4 years ago now. We're still waiting for the white paper. There keep being noises from the government that the white paper is imminent. I think about a month ago it was imminent. We still haven't seen it. I don't know if it's in front of cabinet now. But we're very worried. We support, that's People's Health Movement, we support the idea of a health system based on equality and based on good quality service that can be afforded by the country. I'll come to the doctor issue in a minute. But we're worried that the grinding cogs of this process seem to be stuck up there in the corridors of power without any transparency, without any discussion. We don't know what's going on, and we suspect that this is going to be like a huge public-private partnership where that'll bail out the private sector from its crisis of unaffordability and not do enough to promote really good standards in the public sector. And at the moment, it's impossible for the public sector to really use the money in such a fund because it's kind of been allowed to degrade over the last few years in many places. So we're worried about this NHI. Now the issue of health professionals, the people who work in the system, that's a big problem. We know that the government's doing its best to increase the production, if you like, of doctors, including sending more and more to Cuba for training and creating new medical schools here, which is good, all of it, including the Cuban bit, no matter what people are saying about that. But we're going to have to rely on community health workers as a big category of our health system. Community health workers who live in the community, who come out of the community and who provide not only services, but who also mobilize people around health. Because this is the thing that is lacking. TAC does a lot of it. Other organizations are doing it. This is mobilizing people to act and demand their right to health and healthcare. And that's, as I said, it's important to focus not only on the health system and the hospitals and the clinic, but also on education, on safe transport, on security. These are things that are very important.
There's a broader problem. And we have a few seconds to round up.
Yes.
What is your concluding remark?
Okay.
And how do we begin to fix health in this country?
Okay, I think we are going to fix a health system in this country by allowing the community to be involved. For example, I was sharing this to doctor that in Khayelitsha, I was the first person to allow the community adherence club to take place in my house here in South Africa. But now I'm very happy that the government now is taking that initiative now. They are opening a community adherence club even in Free State and other provinces, but it's taking too low. Hence, Doctor has spoken about the community healthcare workers. That is very important because I know and I understand that people from my community, and also it also break out stigma and discrimination against people living with HIV and AIDS and TB as well. So for me, I think if we can decentralize the work, that is how we are going, and involve those community care workers. They should be part of those of the health system. Although we need professional doctors, we need professional nurses, and also pharmacists, but we really need also involvement of community care workers.
Diversification, you say?
Yes,
right.
Yes.
Well, that's where we're going to have to leave it. One answer, a broad problem that Dr. Louis Reynolds says that we need to deal with. It doesn't just involve the health department, and of course, if there's any health department official or even government official that's listening, watching, viewing this program, I think it's shoulder to the wheel, because ultimately at the end of the day we try and save lives and we up the life expectancy as well as the general well-being of people in Cape Town and South Africa. So that concludes our program for this evening. My name is Tashirik Trubadi. I was joined by Dr. Louis Reynolds. He's from the People's Health Movement, as well as Andile Madondile. He is from the Treatment Action Campaign. I trust that you found the discussion informative, and of course any views on this you can of course take to social media, the CTV Facebook page, and of course any other platform. Let us know what your thoughts are on this particular matter. From myself, Tashirik Trubadi, have a good evening. Enjoy it.